here, you can see up here on the board, all right, that we have a couple names for this bone. Okay, os coxa, innominate bone, coxal bone. Okay, so you can answer it with one of those choices. All right, when you're asked on the test. Does anyone happen to know what view this is of the os coxa? Bang, lateral. Because, and I'm assuming you said that because of that, because the acetabulum. Yeah, that's the acetabulum. That's where your femur is going to articulate. That's where your leg is going to form the hip joint. So this has to be the lateral view here. Okay. So we're going to now break it down. Remember, there's three bones that form the os coxa: the ilium, right, the ischium, and the pubis, or pubic bone. So we're going to talk about those three bones here. Okay, you can see right here the arrow is identifying the ilium. So it's all of this. So it makes up the superior portion of this bone, and it's a majority of it too. Okay, so here it is on the lateral view. Okay, then here it is on the medial view. All right, medial view. All right, you don't see the acetabulum. Okay, and the medial view has this nice smoothed area, which we'll identify really soon. Okay, this nice smooth area. Okay, so here's the ilium on the medial view. Okay, now here's the ischium on the lateral view. This is anterior. This is posterior. Okay, so the ischium is on the back side. You're sitting on the ischial tuberosity. Okay, so here it is on the lateral view. Here you can see it on the medial view. You don't see the acetabulum. So that's posterior inferior portion of the os coxa is the ischium. And then that just leaves us with the pubis, or the pubic bone. And that's going to be the anterior inferior portion of the pubis, of the os coxa. Okay, here it is on the lateral view. We'll twist it over, and here it is on the medial view. Okay, so those are the three bones that are going to make up the os coxa. So we're going to talk about now some of the things that you need to be able to identify for our test. So obviously the acetabulum, all right, that's our socket for our ball and socket joint, the synovial joint there. Okay, and then up here, now this arrow or this dashed line doesn't go quite so far. It should continue on down to here. Okay. So like I said last week, when you put your hands on your hips, you're putting it right on the iliac crest there. Okay, this is the posterior, this is the anterior. All right. So the anterior crest is going to run in between two anatomical structures, and we're going to label those. All right, on the front here, this little nubbin there, that's the anterior superior iliac spine. You cannot answer the test with that. That does not. Abbreviations don't count unless it's a nerve, artery, or vein. Okay? So don't call it the ASIS. You have to write out the full name. So anterior, meaning it's on the front. Superior, because there's two of them. There's a small one down here, and that's the, you don't need to know this for labeling, that's the inferior iliac spine. So we're talking about the top one. So it's the anterior superior iliac spine. Now we're going to jump on top of the iliac crest and ride it all the way back to this guy back here. Okay? But before we do, let's flip over the bone and see the anterior superior iliac spine from the medial view, right there.
Do we type in the bone?
You don't have to, for that, you don't need to write in coxal bone. You could just write in anterior superior iliac spine. Yeah. All right.
Unless it asks for what bone.
Unless it asks for the bone, or if it's a long bone and it's pointing to the head, then you should say head of the humerus or head of the femur, radial head. You can say head of the radius or radial head. Okay. All right. Now we'll go to the back end of the bone, and this is one of those bumps that you feel on either side of your spine and down in your low back. That's the posterior superior iliac spine. Right, again, this is on the anterior view, excuse me, on the lateral view. Here's the posterior, that's the back. Here's the anterior, that's the front. All right, now we'll just flip it over. And there's the posterior superior iliac spine right here. Okay. So on the medial view here, that smooth area that you see there is the iliac fossa. The iliacus muscle sits there, okay? We'll learn that when we do the muscles. Okay, so that's the iliac fossa. It's on the medial view, on the inside of your hip there. Okay, so this outlined area is known as the auricular surface, and we know that that's the actual part, the physical part of the os coxa that directly articulates with the sacrum. And it forms, does anyone remember the name of the joint that it forms? It's named after both bones. Sacroiliac joint. You might get that on your test, so you need to be able to identify that. I'll show you. I got a slide on here that will display it for you. Okay? So it's the auricular surface. Okay, so right below the auricular surface, you got this carved out area right here. Okay? That's the greater sciatic notch. We talked about this earlier in the week. That's where your sciatic nerve is going to exit out of your pelvis and go down your rear end and down the back of your leg. Okay? That is known as the greater sciatic notch. Here you can see it outlined nicely on the lateral view there. Greater sciatic notch. Right, that should be the last structure that you need to know for the ilium. So now we're going to go down into the ischium. You see this little nubbin hanging out there? That's the ischial spine. The ischial spine is in between the greater sciatic notch and the lesser sciatic notch. So here you can see there's the lesser sciatic notch, right below or inferior to the ischial spine. Okay. Then you got your ischial tuberosity right below, all right, the lesser sciatic notch there. Okay, that's where your hamstring muscle's attached to, and that is the bone that you're actually sitting on right now. Sometimes referred to as the sits bone. Right. All right, on to the last of the three bones here for the os coxa. All right, this is the pubic bone. So you have pretty much extending out from the body here, superiorly above this structure right here. That's the obturator foramen. We'll see that in a second. So this extension of bone here is the superior pubic ramus. Okay, you'll find that above or on top of the obturator foramen there. It's tough to see, again, and it has to do with the angle, but it's just that area of the bone right there. That's the superior pubic ramus. All right. If there's a superior, there's an inferior. So right through here is the inferior pubic ramus, which is kind of inferior to the obturator foramen, a little bit medial to it. I'll be able to show you a little bit better when I have a full picture of the pelvis here. I'll show you in a second. All right, here you can see it a little bit better. So that's going to be all that's going to be the inferior pubic ramus. All right, there's your obturator foramen. All right. So this right here is where the pubic symphysis would be. This is the symphyseal surface here. All right. So remember what we talked about, the pubic symphysis? That's the place, for one, it's one of those joints that we were talking about, all right, those cartilaginous joints. And that was a classification of the cartilaginous joints were the symphyses. This is one of those. The discs in the spine are another. So here you can see, I like this view here. So there's the pubic symphysis, all right here. All right, and then you can see this pretty much from here to here, that's the superior pubic ramus. And then pretty much from here to here, that's the inferior pubic ramus down here. So you can see how it's kind of inferior to the obturator foramen, but more medial to it also, more towards the inside. And if you were to say, is this a male or female pelvis? That's right. May I ask, what made you say that? Yeah, you're right. I mean, you have a wider opening here, okay? The flaring of these are the sacral ala right here, okay? It's tough to see, but this opening is bigger too. I'm just scribbling. But the subpubic angle here, remember what I told you, all right? In women, it's more like a U, all right? It's more kind of gradual. In the male pelvis, it's more like that. I mean, not that sharp, okay? But yeah, this is there's much more flaring here, all right, of the ala in the female pelvis. Good, 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 good. All right, here's the picture of the acetabulum here on the lateral view. And then here you can see, and I think it's on the next slide, but there's the sacroiliac joint right here. All right, where the sacrum and the os coxa, or the ilium, meet up with one another. So we've already seen this one. There you go. Sacroiliac joints. Don't call it the SI joints. No abbreviations. I don't know why I left that on there. Okay. All right. Female pelvis. See, we were right. I was just guessing. I'm just kidding. I knew all along. Here's the male pelvis. And again, you can see. All right, let's go back. Male pelvis, female pelvis. All right, again, here's one way. There's your U. Right, here's the V. Okay, the distance is not very big here to here, and the pelvic inlet here is not very big compared to this pelvic inlet, which is much bigger. All right. All right, well, I'm going to take a break on this and finish up the other slides here real quick. And then we'll finish up the lower extremity. All right, we finished up the... Okay. So let's, just a few slides here for the bones of the lower limb, okay? So similar to what we saw in the upper extremity, remember how in the arm you had the humerus, one bone, then in the forearm you had two bones, okay? Well, in the lower extremity, in the thigh, you have one bone, the femur. In the lower part, which we call the leg, you have two bones, the fibula and the tibia. And then we saw in the hand, you had 8 carpal bones. The foot's a little bit different. You have 7 tarsal bones, okay? But then when we got to the palm of the hand, you had the 5 metacarpal bones. Well, in the foot, you have 5 metatarsal bones, And then we have the same exact number of phalanges in the foot as you did in the hand. So that's easy. So the metatarsals are the same as the metacarpals in number, and the phalanges are the same in the foot as they are in the hand. So really nothing new, except we have one less bone. All right, we have 7 tarsal bones instead of 8 carpal bones. And we have a kneecap. So I guess we make up for that bone, we just stick it in the knee. I'm cool with that. All right, so when we talk about the femur, we're talking about being in the thigh. Okay, the thigh. One bone in the thigh, one bone in your arm. Okay, or the brachium. So this is the longest, strongest bone in the body, hardest to break, but when you do break it, you want to cry for days and days and days. It hurts, right? So the head of the femur is going to articulate and create what we call the femoral acetabular joint with the acetabulum, right, in the os coxa. At the top of the head, all right, if we look at the head straight on, there's a depression here. It's known as the fovea, also known as the fovea capitis, all right, C-A-P-I-T-U-S, capitis, supposed to be an A, all right, and it's a tiny depression at the top of the head, and that's for a ligament. It attaches right there in the fovea capitis, and then it attaches into the acetabulum, helps to hold the head of the femur into your acetabular joint there. Now, as we move away from the head, we're going to come to the neck. Here's the head. It starts to taper down into the neck. Okay, then the neck goes laterally and inferiorly at an interesting angle. And then the diaphysis of the femur goes down. So where it tapers down, there is the neck. It's going to be angulated, all right? And that's what they talk about, this medial angling of the femur. This area here, the neck, is the most commonly fractured area of the femur if it's going to fracture. When you hear that grandma had a broken hip, that's what's breaking, okay? Because of all the downward stress that you have, these shearing forces that just shear that neck. And over time, if you get osteopenia, osteoporosis, you're more prone to it, okay? All right, as we move, all right, away from the head, okay, from the neck, then you have this big part of the bone that comes out, and then it goes down like that. That's the greater trochanter. Okay, you can feel that. Like when you feel your hips on the side of your legs there, and you feel a bone, that's your greater trochanter. It's an attachment site for muscles in your rear end. Okay, so the greater trochanter is laterally. Then you have this smaller bump on the inside. All right, that's called the lesser trochanter. Okay, and it's the lesser trochanter where we're going to get some thigh muscles inserting on there. The strongest muscle of your hip flexor is going to be inserting there, called the iliopsoas. All right, so we'll see quite a few muscle insertions on both the trochanters. Right, obviously, the greater trochanter is going to have more. It's closer to the gluteal region there in your thigh muscles. But you'll get some on the lesser trochanter too. So in between the trochanters, we have this small crest. You don't need to identify the intertrochanteric crest, all right, but you'll see this ridge there, and I'll show you later on. I think we can see it on our slides. But that's called the intertrochanteric crest. These other ones you don't need to know, so we'll skip this slide. Oh, wait a minute. Okay, phew. All right, so now we're going to go down to the distal end of the bone. All right, and in the distal end of the bone, you have these two condyles. Okay, so this is the medial side, and this is the lateral side. And these two condyles are named after which side they're on, and they help to make up the knee joint. So the one on the inside is called the medial condyle. The one on the outside is called the lateral condyle. And this space here in between is referred to as the intercondylar fossa. Because in that space, you're going to have, have you folks ever heard of, oh my gosh, give me a second, your anterior cruciate ligament and your posterior cruciate ligament, PCL, ACL. You ever heard people, all right, tore my ACL? Those ligaments are responsible to prevent the bones of your knee from sliding back and forth on one another. Well, they occupy that space, the intercondylar fossa there. So above the condyles, you have these tiny bumps here and over here. Okay, and those are epicondyles. So the one on the inside is called the medial epicondyle. The one on the outside is the lateral epicondyle. And then on the front of the bone of the femur, you have this smooth depression there on the front, and that's called the patellar surface. You don't need to know that for identification purposes, but that's where the patella, your kneecap, is going to be. All right. So just a quick review. We're going to label all this, okay? But you can see what I'm talking about, the angle here of the neck. Okay, so you have your head, and then it's angled inferiorly, and it goes off laterally. Okay, this is where, if it's going to break, it's going to break there. Has anyone ever heard of a sesamoid bone? Does anyone know what a sesamoid bone? You have? You've heard of it? Oh, you fractured yours. Okay. Okay. A sesamoid bone is a bone that lives inside of a tendon. You've got a couple by your thumb. You've got a couple in your large toe. All right. This is the largest of the sesamoid bones. Okay. So it's housed within a tendon. Okay. And so the name of the tendon that it lives in is your quadriceps tendon. All right. But what it does is it allows for much smoother movements during contraction and relaxation. And it also, believe it or not, helps to protect the knee joint. Because when your leg is extended, when your leg is straight, it covers the front portion of that joint space there. So it does offer some protection. All right. Now on a test, you will probably see something like that with none of the writing on there. Just be able to identify the bone. You don't need to know which side is which. Okay. All right, but you can see we have some articular cartilage here. All right, but that's what the patella is going to look like. So if it's, I don't know how you would describe that shape. I don't know. I can't think of a single word to describe that right now. A popcorn, perfect, there you go. But if you see that, that's what it'll ask you. You'll just have that on there. So be able to identify the kneecap. Oh, excuse me, the patella. Don't call it the kneecap. Okay, so let's go down to the leg. Okay, you got to keep in mind, let me go back to this one slide here. When we're looking at the skeleton here, all right, this part of your lower extremity is called the thigh. This is the leg down here. The leg has two bones. Okay, just like this is your arm or brachium, this is your forearm or antebrachium. Okay, so keep that in mind. When you hear the term leg, anatomically, they're talking about this down here. They're not talking about the whole thing. And up to this point, we said our leg, we're talking about the thing that we walk on. All right? We're not talking about that anymore. We've changed our terminology. Okay. That's right. Yep. It's tough. Okay. So when we talk about the leg, right, similar to the forearm, you have two bones that are parallel to one another. Okay. But in this case, right, we have to deal with weight bearing. So the bigger bone is going to be more medial. That's going to be our tibia. It's the bigger, stronger bone, so it will be the weight-bearing bone. Then lateral to it, we'll have the fibula. And in between these two bones, we saw it in the forearm. Remember that interosseous membrane between the radius and the ulna? Well, we have that here. That's a joint. Okay? And it does the same thing, all right, in the leg as it did in the forearm. It's going to help to stabilize the position of the fibula on the tibia. So it's not wobbling around there. It creates a solid, stable joint. And it's important, all right, when we're dealing with weight bearing. Okay? So there is a little bit of a pivot going on there. Slight pivot. You know how we saw when we had supination and pronation in the forearm? We're not going to have that in our leg. Okay? But there is a slight amount of pivot in the leg. Believe it or not, your knee rotates about 5 degrees when you extend it. At the very end, the last 5 degrees of extension, your knee will twist slightly. There's a muscle, you don't have to know it for identification purposes. It's called the popliteus muscle. And when your leg is completely extended, it locks the knee in. It helps to provide that stabilization there because there is a little bit of twisting. Okay? It's not a pure hinge joint. Okay. So here's the tibia. All right? So you can see it's more medial. Lateral portion here. And again, if you're not sure, all right, this is an anterior view. How do I know? There's the patella. Okay, I won't be able to see that on the back. Okay. The tibia is medial. The fibula is lateral. Where's the big toe? Big toe is medial. It's on the inside. These are things that you should be looking for. Where's the big toe? It's on the inside. All right, the tibia here is on the inside. This is the anterior view because I can see the patella. Okay, these are little things that will help you to figure out where you are. All right, so on the tibia, we're going to talk about the proximal epiphysis. What is that? That's the part that's by the knee. So on the top of the tibia, you have a flat surface. It's relatively flat, but it's a flat surface. Okay? And so you have on this flat surface, all right, the areas, remember we learned on the femur, you have a lateral and a medial condyle. Okay, and a condyle is a rounded surface. Okay, don't ask me why they did this. I have not found an explanation to this anywhere in the literature. All right, but the on the tibia, on those flat surfaces, on the medial portion of the tibia, all right, we call that the medial condyle. And then in the lateral portion, because the top of the tibia looks like this, they call it the tibial plateau. And then the tibia tapers down, okay? So if this is the lateral part and this is the medial part, all right, this would be the medial condyle and this would be the lateral condyle. All right, it's goofy, but anyways, in the center of it, you'll see this little structure that looks like an elevated U, all right? And that's the intercondylar eminence. That is where your anterior cruciate ligament and your posterior cruciate ligament attach onto. All right, so the anterior and the ACL and the PCL will attach onto the femur, and then they attach onto the tibia. So you have that little raised portion of bone there, and that's called the intercondylar eminence. On the front of the tibia, you can feel it right below your knee joint. You'll have a bump. That is where, all right, the quadriceps tendon or the patella ligament attaches onto. And we call that the tibial tuberosity. So you'll feel that right on the front. Okay. So going down now to the distal end, we don't have to worry about the anterior border. That's the shin. You don't have to identify that. All right, but we have a structure, and you don't need to know the inferior or articular surface. If you feel on the inside of your ankle joint, you'll feel a bump there. Okay? That is called the medial malleolus. Okay? So that will be on the inside of your ankle. You'll feel that little knobby bump there. And that is part of your ankle joint. And that's on the distal part of the tibia. All right, fibula. Let's have at it. That's the lateral non-weight-bearing bone in your leg, okay? And you're going to love this. But I'm going to tell you this right now. Please, if you look at this, this bone at first glance when you're taking a test will look very similar to the radius. All right? Some people will confuse the tibia and the radius. Some people will confuse the fibula and the radius. So that's why it's really important that you get a good handle on, all right, these individual long bones here. I think the femur is pretty, the femur is pretty unique in the way it looks. I mean, it's really hard. And I usually if people miss that, I feel like they didn't study the material enough because it's just a very unique looking bone. But these bones here, the tibia, the fibula, the radius, and the ulna can be somewhat confusing. All right, because they look somewhat similar. But if you study it enough, then you'll see the differences, okay? So that's what I'm saying. Just really focus on learning those differences. All right, so the fibula. Non-weight bearing, lateral bone. Okay, there's three parts that you need to know. Okay, the proximal end of the fibula has the head of the fibula. All right, and then just inferior to that, you'll have the neck. It's important to understand that the neck, the common peroneal nerve, which is the nerve that gives you sensation on the lateral side of your leg and controls the muscles on the lateral portion of your leg, it wraps around the neck. You fracture the neck, you sever the nerve. Okay, and you'll have issues with walking. Okay, and you'll have paresthesia, altered sensation. Go ahead.
Is it possible to break one and not the other?
Oh yeah, yep, I have. Yeah, there it is. And at the far end then of the fibula, we go back down to the ankle joint. You'll feel that bump on the lateral side of your ankle, and that's the lateral malleolus. Okay, this is a part of that ankle joint. Okay, so here you can see, if you take a peek, all right, both of the bones, and you just make sure, I can't stress it enough, look at them, really get a handle on how they look individually. All right, let's finish up the foot here, and then we'll do some labeling. Okay, so in the wrist, we had carpal bones, all right? In the foot, we have tarsal bones, okay? And in the wrist, we saw that you had two rows, a proximal row and a distal row of carpal bones, right? And there's 4 in each. Well, in the tarsals, it's a little bit different here, okay? We do have a proximal and a distal row, okay? So what we're going to see here in the proximal row, we're going to have our talus, calcaneus, and navicular bone. Well, what are those? Start with the easiest one to identify. The heel bone is the calcaneus bone. That's the largest one. And then there's 2 bones directly in front of it, all right, and a little bit superior. The talus, this here makes up your ankle joint primarily, the talus. I'll show you. And then in front of that, on the medial side of your foot, is the navicular bone, okay? So those 3 make up the proximal row. Now when we go more distal, you have 4 bones. You have the 3 cuneiforms and then the cuboid bone. So the cuneiform, the medial, intermediate, lateral cuneiforms. So the medial is going to articulate with your first metatarsal. The intermediate will articulate with your second metatarsal. The lateral cuneiform will articulate with your third metatarsal. And then the cuboid is going to articulate with your 4th and 5th metatarsals. All right, so the cuboid is going to be the lateral placed bone. So let's take a peek. Here's a nice foot x-ray. This is a dorsal view, and this is a lateral view here. Okay, so this is, we take a picture down at the top. So it's hard to see the calcaneus from this view. You can see part of it, and then the navicular bone, all right, the talus. They're all kind of on top of one another here, all right. Well, the navicular is a little bit better, but here's the calcaneus, here's the talus. All right, but here's your distal row. So this is your medial cuneiform, your intermediate cuneiform, and then the cuboid and the lateral cuneiform are kind of overlapping over here. Here's the calcaneus, there's your heel bone, and then there's that talus bone right here. Helps to make up the ankle joint. If you want to see them individually, it's a little bit easier. So here's the superior view. Here's the talus. So on each side of the talus, on the medial side, you'll find the medial malleolus from the tibia, and then on the lateral side of it, you'll have the lateral malleolus from the tibia. Right? And then if we flip the foot over, this is the inferior view, here is the calcaneus right here, okay? And then you can see it from the superior view. This bone right there, that's in the way, that's the talus. Calcaneus is down here. Here's the calcaneus here. All right, and then where's the navicular? Oh, here's navicular. Navicular is just in front of the talus. So then when we look at the distal row, here's the medial cuneiform, here's the lateral cuneiform, here's, the intermediate cuneiform, here's the lateral cuneiform. And then cuboid is way over here. There's cuboid. All right. Metatarsals, same thing as we saw up in the wrist. Instead of saying carpal, we say tarsal because we're talking about the foot. All right? So we number them the same exact way. Roman numeral 1 through 5, starting medially. What's that mean? We start with the big toe. Okay? The BT, big toe, or the hallux. And then we go out to the pinky toe. Pinky. Okay? So the metatarsals are going to help to form the arches in your foot. All right? So they're going to articulate with those cuneiform bones and the cuboid bone. So you'll see, you heard me talk about sesamoid bones. You don't need to be able to identify that, but on that first digit there, all right, on the hallux, all right, which is another name for your big toe, right, we can sometimes see these tiny sesamoid bones, which will be by the head of that first metatarsal. They'll be in the tendons. They'll sit out there in the middle of nowhere. So let's take a peek at the tarsals. All right, so here you can see our tarsals. All right, so this first tarsal bone by the big toe is metatarsal number 1. You can see it listed here. Metatarsal 1, second toe, metatarsal 2, so forth and so on. And then the last one is metatarsal number 5. And then, since we already know how to label the phalanges in the hand, it's the same exact numbering system, okay, in the foot. Okay, same number, 14, which means one toe only has 2, and that's the big toe. So it has a proximal phalange and a distal phalange. Can you imagine that your fifth toe, your pinky toe, has 3 phalanges? It's crazy. It's got 3 tiny little phalanges in it. Okay, you would think that the big toe would have 3, but it doesn't. Okay, so the big toe only has 2. All the other ones, all right, have 3. So if we look here, you can see, all right, all 5 digits have a proximal phalange. All 5 digits have a distal phalange, even number 5, really tiny. And then only digits 2 through 5 have a middle phalange, or phalanx. All right, you cool with that? And then if we look at the big toe, the hallux, all right, that has a distal phalange and a proximal. All right, let's do some labeling. Let's do some labeling. All right, we'll finish up here and label the femur all the way down to the toes. Okay. So again, what we're looking at here, okay, as you're labeling, a couple things. This is the proximal end of the femur. This is the distal end of the femur. This is the medial side. This is the lateral side. Okay? And this is an anterior view of the femur. Okay? Partially because you can't really see it, but the patellar surface is right over here. It's that smooth area there. But how I also know that this is the anterior view is because I cannot see the condyles very well. Now, if I flip the bone over, for example, here, now you can see the condyles down here at the distal epiphysis. Okay, so here's the posterior view. I'll flip it right back. Here's the anterior view. You can't really see those rounded condylar surfaces as well. So that's why I tell students you can use that as one of the ways to be able to differentiate, okay, the anterior view from the posterior view. What I get more worried about is people not knowing medial and lateral, because they'll all the time mess up on the epicondyle and the regular condyles. They'll mislabel it. They'll think it's the lateral condyle when it's the medial condyle. So the head is going to be medial, just like the head of the humerus. Remember? We said it was medial because it has to articulate with the axial skeleton, or it has to articulate towards the axial skeleton. All right, and this is the lateral. The greater trochanter is on the lateral side. Okay, so let's flip it over. Here's the femoral head, all right, on the posterior view. Okay, so you see there's a little indentation right in here? All right, that is the fovea, or the fovea capitis. So if I was looking at the head dead on, I could see this nice circular depression in there. But since we're looking at it, this is again the posterior view because I can see the condyles nicely. They look like knuckles. All right, so that's the fovea. You can use it either or, fovea or fovea capitis. Either or is fine. All right, so let's move away from the head and look at the neck. All right, we are now looking at the anterior view of the femur. You can see where the head starts to kind of taper down. That's the neck. All right, now we'll flip it over. And there it is on the posterior view. There's the neck. Okay, so we're going to stay on the posterior view, and we're going to take a peek here now at the greater trochanter. Right, you can see it's this big bony process coming off. Lots of thigh muscles attached there. Your gluteal muscles will attach there. It's a big site for muscular attachment, and even some of the external hip rotators will attach onto that. Okay, so that is the greater trochanter. So we'll flip it over to the other view here on the posterior side. There it is on the posterior side. All right, so we saw the greater trochanter. Now we're going to take a peek at the lesser trochanter. So you can see it here. It's kind of coming out at us. All right, but we're going to look at it here from the anterior view. You can see it peeking out from the side there. Again, the lesser trochanter is on the medial side of the bone. Medial, lateral. All right, first thing I always do is check where the head is. And if I have to identify something on the distal epiphysis, I look where the head is. If I'm on the same side of the head, then I know that's medial. And then if it's on the other side, it's lateral. Okay, so here's the lesser trochanter on the posterior side. Okay, so let's drop down to the distal epiphysis here, and let's label our condyles. All right, so we're on the posterior side, but look, we're on the same side as the head. Okay, so if we're on the same side as the head, that's the medial side. So here's the medial condyle. Condyle is a nice, smooth, rounded, convex surface here. That is the condyle, medial condyle. All right, now let's jump over to the other side of the bone. That's the lateral condyle. Okay, it's on the same side as the greater trochanter. That's lateral. All right, now we're going to go to those areas above the condyles. Epi means above. So that bump right there above, now if I'm not sure which side of the bone I'm on, I look for the head or the greater trochanter. So I'm on the same side as the head. I know I'm on the medial side. So it's pointing this little bump up here. Okay, that's the medial epicondyle. Now we'll go to the other side. There's the lateral epicondyle. Do y'all remember what attaches onto the epicondyles? Muscles. Muscles. Okay? It's a site for muscular attachment. All right, so now we have this space here. That's where our ligaments are going to run. It's the intercondylar fossa. Intercondylar, meaning between two condyles, fossa. All right, let's check out a special bone. There's our special bone. All right, largest sesamoid bone in the body, the patella. Okay, let's get into the leg. Here's a couple things that I want you to be able to tell. First of all, I'm on the anterior view of the tibia, and this is the medial side. How do I know that? Well, go down to the bottom of the bone, the distal part, down here. See that little nubbin hanging out? That's the medial malleolus. So first of all, I want to identify which is the medial side and which is the lateral side. Find the medial malleolus, that's the bump on the inside of your ankle. See which side that's on, and that's the medial side. Now, is this bone anterior or posterior? Well, I see this structure right here. We're going to label that in a second, but we saw it before. That's the tibial tuberosity. That's that bump that the patellar ligament or the quadriceps tendon inserts onto. It's right below your knee. You can feel it. I'm feeling mine right now as I'm telling you guys this. So let's get rid of all that stuff and then just see what the arrow is pointing to. All right, this right here is the medial condyle. All right, so we'll flip it over. Now look, check it out. Here's that's the tibial tuberosity right here, right? I'm going to make it disappear. It's gone. It's not here. So I'm on the back side now. Okay, I can't see the tibial tuberosity. I can still see the medial malleolus, so I still know that this is the medial side and this is the lateral side because I see my little nubbin at the bottom. Okay? So we're seeing at the top here, that's the medial condyle. Okay, let's flip it back over. Now we're back on the anterior side. I know this because there's my tibial tuberosity again. So I'm on the front. Find out where the medial malleolus is. We're on the opposite side of it. This is the lateral side. This is the medial side. So that is the lateral condyle. Lateral condyle is on the top or the proximal epiphysis of our tibia. Flip it over. There is no tibial tuberosity there. So I'm on the back. And there's my medial malleolus. We're on the opposite side. So this is the lateral side. This is the medial side. You see the pattern? You see what I'm kind of doing here? All right. Look at these views. Study them. Okay. All right. And then in between the two condyles is that intercondylar eminence. This little raised area here. All right. Those are where the cruciate ligaments attach onto. Keeps our knee stable. Keeps it from sliding or shearing back and forth on itself. Okay, let's go back to the anterior view. There's the tibial tuberosity. There's our bump. And then we'll drop all the way down to the distal portion, and there's the medial malleolus. That's the only structure that we need to know on the distal portion of the tibia. Medial malleolus. Here it is on the anterior view. You got a question? Go back? Yeah, sure. To this slide? Cool? All right. And here is the medial malleolus right, on the posterior view. All right, the next bone in the leg is the fibula. There's only 3 things that you have to know on the fibula. And 2 out of the 3 are generic terms. Head and neck. All right, easy. I'll never flip the bones upside down on you, by the way. All right, they should all, I wouldn't do that, okay? So the top of the screen should be the proximal epiphysis. The bottom of the screen should be the distal. Okay, so this top screen will always be proximal. This will always be the distal part of the bone. I don't do that. All right, fibula, lateral bone, non-weight bearing. Okay, so we're at the top of the screen here. That's the proximal portion. That's the head. All right, and then just distal to that, that's the neck, where it tapers down. And then we go to the bottom of the screen. That's the lateral malleolus. That's the bump on the outside of your ankle. Okay, and then I'll actually show you the lateral malleolus on a lateral view of the ankle right here. So it's tough to see because both the bones are superimposed on one another. I'll do my best. But I'm trying to outline the fibula here. I'm not doing a very good job. Okay, that's the fibula. And then there's the tibia, and then here's the tibia over here. And I know this is the lateral portion of the bone for a couple of reasons, okay? Well, one, here's your 5th digit, okay? You've got 1, 2, 3 phalanges. This is your little toe, okay? This is your 5th metatarsal. Here's the cuboid bone. Because remember what I said, the cuboid bone articulates with metatarsals number 4 and metatarsals number 5. Okay, it's the distal tarsal bone, all right, that articulates with 2 metatarsals. The other tarsal bones, the cuneiforms, only articulate with 1 metatarsal each. See this nice view of the calcaneus here. Speaking of, let's talk about the calcaneus. This is your heel. Actually, where that arrow is pointing, that's where your Achilles tendon attaches, or your calcaneal tendon. All right, so it's going to make up your heel. This is a superior view. So if I'm looking down, this is the medial side of your foot. This is the lateral side. How do I know? There's your big toe. Okay, here's your pinky toe. All right, so that's the superior view of the calcaneus. Let's look at it from the medial side. All right, here's the medial side. Again, how do I know this? Well, here's the big toe. I've only got 2 phalanges here. And plus, I can't even see the tibia. Excuse me, I can't even see the fibula up here. I just see the tibia. Okay? So this is the medial view. So here's the calcaneus. If you actually fracture the bone here, they call that a hatchet fracture. Because I just think the calcaneus looks like a hatchet. All right, or the blade of a hatchet. So hatchet fracture. That's how I remember it. All right, another superior view. All right, I'm going to try to outline the talus here. There you go. That's the talus. And see, this is the dome of the talus right here where that arrow is pointing. You don't need to know that, but I say that because on the medial portion, your tibia, here's the medial malleolus, here's the lateral malleolus. And the dome of the talus sits in between those 2 bones. And it swivels back and forth. And we saw the motion. Do you remember what the motions occur at that joint? It's a funny 2 new terms. Dorsiflexion, plantar flexion. Okay? We point our toes down to the floor. That's plantar flexion. Point them up towards the ceiling. That's dorsiflexion. Okay, here it is from the lateral view. All right, so it's tough to kind of outline. I'll do my best here. There's the talus. So the bone just in front of the talus, this guy right here, that's the navicular bone. So you can see it from the superior view here. There's the navicular bone. So let me make that line disappear. So pretty much everything below this line that I just drew, all right, that's going to be the proximal row of tarsal bones. And then in between the 2 blue lines here, that's the distal row of tarsal bones. Okay, so that's the navicular from the superior view. Here it is from the lateral view. It's right in here. Okay. All right, let's do the distal row. Okay, so here's the distal row. Here's the first one. Now you can use, on my test, I'll allow you to use cuneiform 1 if you want to. Roman numeral 1. You don't have to write out medial cuneiform. If you want to, it's up to you. If you want to do medial cuneiform, it's up to you. All right, so medial cuneiform or cuneiform 1 is going to articulate with metatarsal 1. This is Roman numeral 1. This is 5. All right, we'll show you medial cuneiform from the medial view, right here. So the medial cuneiform, or cuneiform Roman numeral 1, sits in between the navicular bone, and it sits in the metatarsal number 1. All right, let's look at the next cuneiform. There's the intermediate cuneiform, or cuneiform 2. It's going to articulate with metatarsal number 2. Okay, that's this guy. All right, then our third cuneiform is the lateral cuneiform, and that articulates with metatarsal number 3. And then our last, all right, tarsal bone, all right, in the distal row is the cuboid. And that articulates with metatarsals number 4 and 5. This is the most frequently subluxated tarsal bone in your foot. It takes a beating, especially in runners. And we'll actually show it to you from the lateral view. There it is. Okay. Now the real easy stuff comes. The metatarsal bones. Here we go. We'll run through those. There's metatarsal number 1 in your big toe. Here's metatarsal number 2. Here's metatarsal number 3. And metatarsal 4. Finally, 2 views for metatarsal 5. Here's one from the superior view, and then we'll show it to you from the lateral view. Now, I'm not going to go through every single phalanx because I didn't do it for the hand, and I won't do it here. I'll let you folks do that on your own, but we'll hit the major ones. Proximal phalanx 1. Okay, then you'll see proximal phalanx 2. I don't have the slides for it, but this is proximal phalanx 3, proximal phalanx 4, and then proximal phalanx 5. Let me go back one. You can see here's proximal phalanx 5 from the superior view, right there. Here it is once again in the lateral view. Okay, so now for the middle phalanx, there's only 4 digits. Okay, so you have middle phalanx 2 because remember your big toe does not have a middle phalanx. So here's middle phalanx 2, middle phalanx 3, middle phalanx 4, and middle phalanx 5. And then here it is from the lateral view. Right there. And then we have distal phalanges for all of our digits. So there's distal phalanx 1 in the big toe, distal phalanx 2, distal phalanx 3, it's really hard to see, distal phalanx 4, okay, and then distal phalanx 5. And you can see it here from the lateral view, distal phalanx 5. And that's all she wrote. All she wrote. Now, before I forget, I know I did it with you folks, but I didn't do it at home. Just a quick reminder for everybody at home, because I know the computer cut out on me. Just to let you know, this Sunday you have 4 assignments due. All right, Learn Smarts for Chapter 7 and 9, and quizzes for Chapter 7 and 9. Your tests for next week on Monday and Tuesday, the 22nd and 23rd, is when your lecture test is going to be available and due. That's on Chapters 6, 7, and 9. Then on Tuesday and Wednesday, you have your online lab exam on Chapter 8 for the bones. That's February 23rd and 24th. Okay, well that wraps up all the material for both lab and lecture that you will need to know for your second lab and lecture exam. I wish you folks the best of luck and all that. Is there any questions about anything that's going on? Did this thing jam up on me again? Yes, ma'am. The medial and lateral? Yeah, let me.
I don't know if it's better to actually look in person and see in relation versus seeing a bone up there. I just can't wrap my head around where it is. I can't wrap my head around.
Okay. If you want to hang out for a few moments, I'll go over on your sheets with you because that's what you'll be studying from, and that'll make it easier. And this crapped out on me. So, any questions from anybody else? I don't know if anyone can hear me at home. If you're
When we have to say like whatever the bone is,
Right.
like what bone.
If it's a generic term like head, you have to identify it. And read the instructions for the test too, because it'll tell you that you should be identifying like neck of the femur, or femoral neck, or humeral. Okay, it's always easier just to say of whatever the bone's name is for the generic ones: head, neck. All right. Trying to think off the top of my head. Alveolar processes of the maxilla and alveolar processes of the mandible. Okay, some of those you have to say because you need to identify. If it's a generic term, I have to know that you know which bone we're talking about. Okay, but yeah, and take the mock exams. If you haven't, take them. Okay, and take them several times to help you. Remember, quantity, not quality. No, sorry, quality, not quantity. All right, glad that wasn't recording. All right, if there's no other questions, make sure you sign out or sign in, and then I will see you next week. All right, Candace, give me 1 second, and I gotta close this thing down.